This is Pneumonia, Part 1, where we build the foundations, the common causes, how typical and atypical pneumonia present, the telltale signs on examination, how it's diagnosed, and the key nursing care. We'll work through 10 NCLEX style questions together. For each one, read or listen carefully. Pause to choose your answer, and then check your reasoning against the explanation. Let's begin. Question 1. Which organism is the most common cause of community-acquired pneumonia? Option A. Pseudomonas aeruginosa. Option B. Mycoplasma pneumoniae. Option C. Haemophilus influenza. Option D. Streptococcus pneumoniae. Pause here and choose your answer. The answer is D. Streptococcus pneumoniae, the pneumococcus. It is the single most common cause of community-acquired pneumonia. Mycoplasma is the classic cause of atypical pneumonia, and Haemophilus influenza and Pseudomonas are less common in this setting. So for community-acquired pneumonia, think pneumococcus first. Question 2. An 82-year-old man is brought in because he has become suddenly confused and drowsy over 2 days. He has a low-grade fever, a weak cough, a respiratory rate of 26, and a chest X-ray shows a right lower lobe infiltrate. Which best explains his new confusion? Option A. Confusion can be an early sign of pneumonia in an older adult. Option B. Confusion in an older person is always caused by dementia. Option C. Confusion effectively rules out a chest infection. Option D. Confusion is simply the expected effect of a mild fever. Pause here and choose your answer. The answer is A. Confusion can be an early sign of pneumonia in an older adult. In older people, new confusion or drowsiness is often the first clue to pneumonia, sometimes appearing before an obvious cough or a high fever. We must never dismiss it as just dementia or a mild fever, and it does not rule out infection. New confusion in an older adult should always prompt a search for infection like pneumonia. Question 3. A 55-year-old woman admitted with pneumonia has thick tenacious sputum she finds hard to cough up. She is alert, her oxygen saturation is 94%, and she can take oral fluids. Which nursing intervention is most appropriate to help clear her secretions? Option A. Restrict her oral fluids to prevent lung congestion. Option B. Keep her lying flat in bed throughout the day. Option C. Encourage deep breathing, coughing, and adequate fluids. Option D. Discourage her from moving or repositioning at all. Pause here and choose your answer. The answer is C. Encourage deep breathing, coughing, and adequate fluids. Deep breathing and coughing, good hydration to loosen secretions, and an upright position all help her clear that thick sputum and breathe more easily. Restricting fluids, lying flat, and discouraging movement would each make secretion clearance worse. Hydration plus deep breathing and coughing are the mainstays of mobilizing pneumonia secretions. Question 4. All of the following are classic clinical features of typical bacterial pneumonia, except Option A. Fever with a productive purulent cough. Option B. A slow heart rate with no rise in temperature. Option C. Pleuritic chest pain and shortness of breath. Option D. Crackles and bronchial breath sounds over the lung. Pause here and choose your answer. The answer is B. A slow heart rate with no rise in temperature. Typical bacterial pneumonia usually brings fever, a productive purulent cough, pleuritic chest pain, breathlessness, and crackles or bronchial breath sounds over the affected area, generally with a fast pulse. A slow heart rate and no fever is not the classic picture. Expect fever and tachycardia, not a slow pulse. Question 5. A 60-year-old man presents with sudden high fever, rigors, a productive cough with rust-colored sputum, and sharp right-sided chest pain worse on breathing in. His oxygen saturation is 90% on room air with crackles over the right base. Which is the priority nursing action? Option A. Encourage him to lie flat on the affected side. Option B. Withhold all fluids until the fever has settled. Option C. Reassure him that no treatment is needed yet. Option D. Give prescribed oxygen and position him upright. Pause here and choose your answer. The answer is D. Give prescribed oxygen and position him upright. The rust-colored sputum, rigors, and pleuritic pain point to classic pneumococcal pneumonia, and with a saturation of only 90%, the priority is oxygen and an upright position to improve gas exchange. Lying flat, withholding fluids, or delaying treatment would all be harmful. Rust-colored sputum with rigors suggests pneumococcus, so oxygenate and sit the patient up. Question 6. A 21-year-old student has had a week of dry, hacking cough, headache, muscle aches, and a mild fever, but feels well enough to keep attending classes. His chest is nearly clear, yet the X-ray shows patchy changes out of proportion to his mild signs. Which type of pneumonia does this most suggest? Option A. Severe pneumococcal lobar pneumonia. Option B. Hospital-acquired pneumonia. Option C. Atypical or walking pneumonia. Option D. Aspiration pneumonia from choking. Pause here and choose your answer. The answer is C. Atypical or walking pneumonia. A young, fairly well patient with a dry cough, headache, and muscle aches, very few chest signs, but more extensive X ray changes, is the classic picture of atypical pneumonia, often caused by mycoplasma. It is quite different from severe lobar, hospital acquired, or aspiration pneumonia. Mild signs while still walking about with a dry cough points to atypical pneumonia. Question 7. Which investigation is most commonly used to confirm the diagnosis of pneumonia? Option A. Chest X-ray showing consolidation or an infiltrate. Option B. A plain abdominal X-ray of the bowel. Option C. An electrocardiogram of the heart. Option D. A urine dipstick for protein and blood. Pause here and choose your answer. The answer is a chest X-ray showing consolidation or an infiltrate. Together with the clinical picture, the chest X-ray is the standard way to confirm pneumonia. An abdominal X-ray, an ECG, or a urine dipstick would not make the diagnosis. So the key investigation is the chest X-ray. Question 8. A 38-year-old woman with community-acquired pneumonia is on oral antibiotics and feels much better after 3 days. She asks whether she can stop the tablets now that her symptoms have improved. Which is the most appropriate response by the nurse? Option A. Yes, you may stop the antibiotics now that you feel better. Option B. Complete the full prescribed antibiotic course as directed. Option C. Stop the antibiotics but restart them if symptoms return. Option D. Halve the dose for the rest of the prescribed course. Pause here and choose your answer. The answer is B. Complete the full prescribed antibiotic course as directed. Even when the patient feels better, the whole course is needed to fully clear the infection and to prevent resistance and relapse. Stopping early, stopping and restarting, or halving the dose all risk treatment failure. The teaching is simple and important. Always finish the full course. Question 9. Which of the following is an important measure to help prevent pneumonia in an at-risk older adult? Option A. Avoiding all physical activity and staying in bed. Option B. Taking a daily antibiotic on a long-term basis. Option C. Receiving the pneumococcal and influenza vaccines. Option D. Restricting fluid intake to protect the lungs. Pause here and choose your answer. The answer is C. Receiving the pneumococcal and influenza vaccines. Vaccination greatly lowers the risk of pneumonia in at-risk older adults. Staying in bed, taking long-term daily antibiotics, and restricting fluids are not appropriate ways to prevent it. So the key preventive measures are the pneumococcal and influenza vaccines. Question 10. While assessing a patient with suspected pneumonia, the nurse notes dullness to percussion over the right lower lobe, bronchial breath sounds, and crackles in the same area with increased tactile fremiters. These findings are most consistent with which underlying process? Option A. Consolidation of the lung from pneumonia. Option B. A completely normal, healthy lung. Option C. A collapsed lung from air in the pleura. Option D. Narrowed airways from an asthma attack. Pause here and choose your answer. The answer is A. Consolidation of the lung from pneumonia. Dullness to percussion, bronchial breath sounds, crackles, and increased tactile fremiters over an area are the classic signs that the lung has become consolidated, filled with inflammatory fluid. A normal lung would sound clear. A pneumothorax would be hyperresonant with reduced sounds, and asthma would give a wheeze. These findings together mean consolidation. Let's recap pneumonia part 1. Streptococcus pneumoniae is the most common cause of community-acquired pneumonia. Typical pneumonia brings fever, a productive cough, pleuritic chest pain, and breathlessness, and rust-colored sputum is classic for the pneumococcus. In older adults, new confusion may be the first sign. Atypical or walking pneumonia gives a dry cough, muscle aches, and only mild signs. Over an area of consolidation, you'll find dullness to percussion, bronchial breath sounds, and raised fremiters. The chest X-ray showing consolidation confirms the diagnosis. Nursing care means sitting the patient upright, deep breathing and coughing, and good hydration. Antibiotics must be finished in full, and prevention rests on the pneumococcal and influenza vaccines. Keep going, and remember, we don't pass alone, we pass together.